Thank you so much for having me here today. I'm very pleased to be able to speak to all of you. And yeah, I've been on the review committee for the grants for the last year or so, and it's really exciting that this work is going on and that so much diverse research is happening. And I'm happy to tell you how to get more LGBT folks involved in that research. So first I want to tell you a little bit about who we are, and thanks to Farah for telling you a bit already. So RHO, Rainbow Health Ontario, was founded in 2008. We're a program of Sherbourne Health Centre, and Sherbourne is like a mega CHC, and one of our priority populations is LGBTQ. And so we actually just added the Q officially, so I forget too. So now we include Q. And so we have a lot of clinical expertise, and RHO actually builds on that clinical expertise. Our mandate is to increase capacity in health and social services in Ontario to serve LGBTQ people. And we're actually funded by the same research unit at the Ministry of Health that the Women's Xchange is funded by. And we are regarded as a knowledge exchange unit. As Farah mentioned, we do a lot of research. We have 3 pillars of service: communication, training, research and policy, and I'm the research and policy pillar. All of our work is grounded in research, so the training, communication, our knowledge translation strategies as well. And we and I have been involved in a large number of research on LGBTQ health over the last 7 years across Canada in a wide range of topics. So trans health, bisexual mental health, home care. And in the last 7 years, there's actually been quite a sea change in Canada in terms of funding LGBTQ research. And I'll talk a bit about that later. And our primary role in these studies is to ensure the meaningful participation of LGBTQ people, and also to ensure and facilitate the dissemination of the research results in meaningful ways so that the lives of our communities are improved by the research. And as Farah mentioned, we just received $75,000 from the Women's Xchange to do a project on LGBTQ women, body image and body management practices. And as I was sitting here, I was thinking about this, and the way this grant happened was a group of academic researchers came to me, actually at Loblaws. They chased me down at Loblaws, and they said, "We're putting in this grant tomorrow. Can you give us a letter of support?" And I was like, sorry, I'm not going to swear. No, I'm not going to give you a letter of support. Are you kidding me? And these are people I love and are dear to me. But I was like, have you learned nothing? Like, no, we're not going to do that. And so that took us to a year of meeting and talking and thinking about this grant and how to do it in a way that actually was community-based. And now we have this wonderful opportunity to work together. And I'm teaching them stuff, and they are also teaching me stuff. So, and actually at the end of the day, I am co-PI on this with an academic researcher. So I get to decide how to spend the money, and I really like that. So it all turned out well. So the organizers asked me to answer the question, what should be taken into account when doing research with LGBTQ people? I'm sorry, I have to keep up here. So I would say the first thing to take into account is the incredibly long history of discrimination that we have experienced. So we have been perceived as sinners, as criminals, as mentally ill. Any services that were developed for us were about, correcting our internal flaws or our proclivities. And we had no protections in the law or the right to receive equitable services. So that's the starting point. And this is starting to change, obviously, but the change has been slow and the change is very recent. So this is just a timeline. And, I don't know if people remember, but in 1969, it was illegal to be gay or lesbian. Until 1973, it was considered a mental illness. Until 1974, gays and lesbians couldn't migrate to Canada. you know, lots of folks know we are unable to marry until very recently. 2003 in Ontario, 2005 across Canada. And trans rights have certainly lagged far behind. And so it was only in 2012 that gender identity and gender expression were added to the Ontario Human Rights Code, and it's still not in the Canada Human Rights Code. So the history of discrimination is institutionalized, legalized. It was legal for a long time to discriminate against us. And it's still happening, right? We're still just getting rid of that legislative history. And so discrimination has also been embedded in research about our communities. So a lot of research focused on what is the cure for homosexuality? What is the origin? Why did this happen? Like, you know, why don't we ask, like, what is the cause of heterosexuality? It's rampant. Look at all these heterosexuals. My God, what's going on? But no, you know, the focus is on what caused homosexuality because we want to get rid of it, of course. Also, research was like invisibly embedded in services, and this is particularly true around gender identity. So if you still go to gender identity services, you are just automatically enrolled in the research. And so there is a real lack of consent in those processes. More recently, since the 80s, the only way to get money to do research on LGBT health was through, thank you, through HIV/AIDS. So you want to do something on, you know, trans children, you have to coax it in their risk for HIV/AIDS. There was no other way to justify research about our communities. And until 2003 in this country, there were no population health data about our communities. In 2003, the Canadian Community Health Survey added a question, are you lesbian, gay, or bisexual? So now we have a good chunk of data about LGB people. Still, there's no question about gender identity. So we have no population health data on trans folks. Woo. Okay. So now the organizers said practical tips. We want practical tips. So I'm going to give you 7 practical tips to help you engage LGBT communities in research. So first is community-based research, community-based research, community-based research. Like if there was only one tip, I would start here. And I just wanted to borrow the phrase from the disability rights movement, nothing about us without us. So, you know, the question was actually, you know, what are the sensitivities about working with your communities? And the fact is, like, the sensitivities change. You know, I wouldn't do research with, like, you know, the youth today because I don't know their language. The language changes. How we are changes. We're diverse people, right? We are, our communities are people with disabilities. We're people of color. We're have a whole range of gender identities. So you really need to include the people who you want to ask questions about in your research process. Yeah, I think what a mistake lots of people make is that they say, well, we have one white, middle-class, cisgendered woman from Toronto, we're good. You know, we've got it down. It doesn't really do it. My second suggestion is to include us from the initial planning stages to dissemination, right? Like that Loblaws conversation, that is like a no-go, and it should be a no-go because we need to be there in meaningful ways in decision-making positions from the beginning to the end of the process. And I think this is particularly important for this group, is to define what you mean by the term woman. So are you including trans women? Are you prepared for their participation? Are you including people who don't identify as either women or men? Are you including people who no longer identify as women but once did? Are you including people who feel like they are women on the inside but present to the world in ways that we would interpret as male? Are you letting participants define whether or not they are women, Or are you defining that, or are you letting participants define it for themselves? Very important for this funding opportunity. And I also want to say we are not hard to reach. You know, I'm at Loblaws once a week, like I am there, and we know how to reach each other. Like we know, I barely know any straight people. Like we know how to reach each other. However, we may not want to be reached if we don't feel assured that you are working in our best interests. And really the onus is on you to demonstrate that you've done your homework. That you don't send me a survey that asks, what's your gender, male or female? You've not done your homework then. And be prepared for people not to trust you and to spend the time building trust before you start your research process. Five, very important, to develop a critical understanding of LGBTQ health disparities, and to understand health disparities, and particularly mental health disparities, because there are significant and marked mental health disparities in our communities. To understand those as a result of experiences of stigma and discrimination, rather than as an indication of inherent pathology. My sixth tip is to read our wonderful fact sheets. So these are the practical examples. See, I followed your instructions. We created 4 fact sheets about research methods. Oh, Margaret, hi. Margaret actually wrote these mostly with folks. So Margaret knows them better than I do. And so they are designing surveys and questionnaires. People also always call me and they're like, should I say lesbian? Should I say queer? Our fact sheet will help you get there. Working with secondary data, qualitative interviewing, and community-based research. And these are all in the other room. And then finally, call me, because part of my job is to help researchers figure out how to do this. Thank you very much.